Who and what we do not treat.
You know, in life, it's easy to become confused. We all do. It's a normal thing.
So we talk a lot about what we do, who and what we do treat. But to be honest, we only accept a small portion of patients that contact us. And that's because, as we've said many times before, we treat our patients as if they were our mother, father, brother, or sister.
So if you have a pathological instability, we are not the right place for you. Typically, you're going to need a surgeon first at least. Maybe we can do some things afterwards, but this isn't something we would say you should come for.
Look, if you have motor loss, that means that you've got a nerve, or you've got some reason why the nerve is stopping your muscles or other tissues from functioning. We're not talking pain or loss of sensation, but you lost motor function. We're not the right clinic for you, okay? We're just not the right clinic. Most likely you need to see a surgeon first and foremost, and maybe there's something we can do afterwards.
That's right. If you have a systemic disease like cancer or Parkinson's or MS, we do not treat these. We advise you to follow the instructions of your medical specialist. Now, that being said, if you have one of those conditions, but you also have a joint or back injury, or that's not due to these conditions or diseases, of course we can discuss those and see if we can help you with it. For example, if you had Parkinson's and you also have pain from arthritic shoulder, we can discuss that with you, but these are things discussed best on a case-by-case basis.
That's exactly what we cannot say clearly enough. We do not treat systemic diseases, okay? We treat local musculoskeletal injuries and pain.
So that means as well, if you have a fibromyalgia, chronic fatigue syndrome, we do not treat those conditions. As in the previous cases, we might be able to do something for individual joints or individual injuries, but again, these have to be considered on an individual basis.
And acute injuries. Look, typically we do not treat injuries or pain that's been under 6 to 12 weeks, okay? That's what we classify as an acute injury. The reason we don't do this, because typically they get better on their own, okay? Remember, we offer the right treatment for the right patient at the right time. Have a great day.
Bye-bye.